With President Biden announcing last week he plans to end the COVID public health emergency in May, many are looking forward to officially putting the pandemic behind us.
But others are concerned about what the end of the official emergency will mean for health care nationwide.
Tom Kowalski spoke with experts tonight about their concerns regarding Biden's exit strategy. So, Tom, what will this mean for those who've been really relying on those COVID safety measures since the pandemic began?
Well, Mike and Emily, while the Biden administration and some health professionals agree that the pandemic is largely behind us, without that security net of the state of emergency, some are concerned about people struggling in the post-pandemic healthcare system. Last week, President Biden announced plans to officially end the COVID public health emergency on May 11th. And in tonight's State of the Union address, Biden said COVID no longer poses a major threat.
Today, COVID no longer controls our lives.
Some, like epidemiologist Dr. Becky Dawson, are concerned about what the end of the state of emergency will mean for the nation's healthcare system.
The decision to declare the emergency over is a political decision, and it has policy, it has economic, and it has, real workforce issues for federal, state, and local government. It doesn't mean that COVID is gone. It doesn't mean that tomorrow we wake up and COVID case counts are gone and no one's dying from COVID and all of that. It just means that we're shifting priorities.
And Dawson says, while our region has largely returned to a pre-pandemic world, she hopes we can learn from our pandemic experience.
But I do think that there are people that are still thinking about how do we prevent disease spread? How do we protect people who are vulnerable? How do we, learn from these past 3 years and make our communities healthier and safer?
But what will be the potential consequences of officially declaring the emergency over?
People are going to lose their health insurance. They're not going to be able to get testing, vaccinations, treatment for COVID-19 if they are uninsured and can't pay out of pocket. We're going to see individuals who are already experiencing food insecurity caused by inflation really start to feel it as their benefits decrease, some going away entirely. And I think we're just going to really start to feel how broken the system is without this Band-Aid of an emergency kind of holding all the pieces together.
Now, Dawson also mentioned that masking and other safety procedures in medical settings such as hospitals are likely to stay for a while longer, but we'll have more on that on ErieNewsNow.com. Live from the Alert Desk, Tom Kowalski, Erie News Now.